We're on strike for the 11th time because the government has failed to be able to provide us with a credible offer to restore our massive 26% pay loss.
And what would you say to the suggestions that restoring junior doctors' pay is unaffordable?
Well, it's nonsense. The strikes have cost the NHS £3 billion, but pay restoration in one go costs £1.3 billion. So the sums clearly are there. We're not even asking for the deal in one go either. We're asking for a multi-year pay deal. The reality, though, is that the real cost to not restoring pay and losing doctors is that all of the healthcare outcomes will continue to get worse. Life expectancy will come down. Waiting lists for operations will go up. Waiting times in A&E will go up. Now, a sick population is a sick economy, and that will mean that there's less money to go around, which means that things will become even less affordable. Investment in healthcare is a fiscal multiplier. You get a return on what you put in.
Every time we invest a pound in the NHS, we get £4 back in growth. If we want a healthy, wealthy country where people are not on sick leave, where they are in work and they're productive, then we need to be able to provide care for them. And right now, we are just seeing far too many of our colleagues leaving in record numbers, and that needs to change. And that needs to be an election issue. The staff hemorrhage is, there's a staff crisis we have, along with the NHS funding crisis, along with the NHS beds crisis, along with the NHS social care crisis. And government needs to take this seriously. And so after a decade of health workers being undervalued and undermined by government officials, I think the trust is not there. I think the public know that that there's very little faith in our politicians right now, and that's mimicked in NHS staff as well. And so we are not taking anybody's word for it. We're continuing fighting, because if we don't fight, then on the other side of this election, there's not going to be an NHS left to fight for. There are going to be too many of our colleagues are going to leave for lucrative jobs abroad, and there's going to be nobody here left to care for them, and the waiting lists are going to get worse and worse and worse, and then the system will ultimately be privatized, and that will be devastating for patient care, devastating for patient outcomes. And so that's why we have to continue fighting for our patients, fighting for ourselves and for our colleagues and for the NHS at large.
We're from Australia. We work at the Gold Coast University Hospital, and we were just walking past here and came to talk to these gentlemen to see what's going on. We kind of know from our experience, because a lot of UK trained SHOs come over to our hospital to work and fill vital places that we need. And they're brilliant doctors.
We benefit from them wanting to leave the conditions here to come and work in the conditions in Australia instead. So we benefit by stealing a lot of your great doctors to work for us.
Yeah.
But you don't think that should happen, really, in a fair system?
Of course not. Of course not. It should be a system that's equal for all. We all work just as hard as each other, and we're all in the same sort of fellowship, and we should be supporting each other.
And what are some of the stories that you've heard about what the conditions are like for doctors here in the UK?
It's compared to the pay, I think financially it's much more attractive in Australia. I think the hours that are worked are extremely long, and the conditions are difficult as well. I mean, we're having our own healthcare crisis like everywhere else in the world, but we still take time for teaching and take time for breaks and take time to look after our doctors. People deserve good conditions for what they do, and people have worked incredibly hard to get to where they are, and they need to be financially remunerated for that, and acknowledged for all their hard work.
These two Australian senior doctors just walked by asking us, what was going on. And these are the types of people, these are the types of senior doctors in Australia who see exactly what the catastrophic staff hemorrhage of NHS staff, of NHS doctors and nurses and everybody leaving in record numbers, the impact that has on the NHS and the UK healthcare system, but also the incredible benefit that it is for the Australian healthcare system, because right now, and for the last decade, this government here in the UK has been training doctors and then making our lives, lives of doctors, of nurses, of other NHS staff, so incredibly difficult, along with the lives, of course, of our patients, so incredibly difficult. It's driving so many of us out of the system. And so this government is paying for us to be trained here and then to be sent abroad. And does anybody think that makes sense? Does anybody think that is a wise use of money?
So far in this election, we've had Rishi Sunak and Keir Starmer parroting the exact same line, which is that the demand for pay restoration is unaffordable. We think that's ridiculous. The BMA estimated that it would cost around 1.1 billion a year for pay restoration. That is absolutely affordable. The government, Labour at the moment are only pledging to put in an extra 1.1 billion a year, full stop, in terms of NHS, the increase in NHS spending. But we are lagging behind countries like France and Germany to the tune of 40 billion a year. That's how much our NHS has been starved of resource and starved of funding. So we think it's absolutely ridiculous to say that that demand is unaffordable. We think that they should be taxing corporations. We think they should be taxing the rich, and that would generate plenty enough to pay our health workers fairly, and we absolutely think that's what they should be doing. When politicians are saying this is unaffordable or unaffordable right now, what we're saying is we can't afford not to do this. We can't afford not to pay our health workers what they need. We can't afford to not stop these critical staff shortages as soon as possible. And the reality is that involves investment. And the Labour leadership right now in this election have spoken quite a lot about the last time Labour were in government, NHS satisfaction was at an all-time high, waiting lists were being brought down. But the crucial piece of information they miss is that they did that through record levels of spending. They did that through massive investment, which this current Labour leadership is refusing to commit to. So they're inheriting an almighty crisis, and if they don't act fast, then it's only going to get worse and it's going to spiral out of control. So we don't think there's any time to waste. We need action now, not in a few years' time.
So Jeremy, why are you supporting the junior doctors today?
They're striking to get fair pay. They've lost a huge amount over the last few years with pay freezes and effectively pay cuts, and they're actually defending our National Health Service. They're just telling me a very disturbing story about the number of avoidable deaths because of waiting lists in the NHS is the equivalent of a very large plane crash every week. And I'm just here to declare my support for them and my support for our National Health Service.
And what would you say to the suggestion that restoring junior doctors' pay is unaffordable?
Well, if we can afford tax cuts and national insurance cuts for the best off, if we can afford to spend apparently a great deal more money on defence and armaments, then surely we've got our priorities wrong. The priorities ought to be making sure everyone has good health care and good access to health care. But with millions waiting for operations because of the shortages in the hospitals, doctors leaving because they're underpaid and can't afford to stay any longer, then we're getting something wrong. What we're doing is training doctors, and the training is absolutely brilliant, the experience is absolutely brilliant, and it's of great benefit to the Australian Health Service.
And how hopeful are you that the incoming Labour government will be good for the NHS?
Well, they say they're going to deal with the waiting list, and they say they're going to deal with the issue of the doctors' dispute. They don't exactly say how, and unless they're prepared to say how they're going to increase income into the NHS, either by cutting something else or by increasing taxation of the wealthiest, then it's very hard to see how they're going to deal with it.
They're all talking about growth. They're all talking about economic growth in this country. But we've got what they're also saying, excuse me, that we've got a very sick society, and a sick note society. So there are more people now getting sickness and unemployment benefit than ever before. So what do you want to do about that? Do you want to invest in the health of the nation? In which case then you start to see people being fit for work and going back to work and getting a growth into the economy again? Or do you want to just say, oh no, well we can give health to those who can afford it, because that's what's going to happen otherwise. And the poor people, because we've seen a massive distance created between the rich and the poor over the last 14 years. And the poor people are the ones who are going to suffer from their health. They're going to suffer from mental health. They're going to suffer from chronic diseases. They're going to be dying earlier. And we're already seeing those rates reducing. People's life expectancy is now coming down in certain areas. So if people are saying it's unaffordable to put that money into the National Health Service to pay doctors and nurses, I'll say that, then they're looking at a situation, it's a contradiction, isn't it? They're not going to be getting economic growth unless they look after the health of the country.
And what are conditions like for doctors at the moment?
Doctors are feeling down and just outright tired and frustrated. We don't want to be in dispute. We just want our pay to be restored, and we want to be able to retain doctors, because currently doctors are leaving in their droves. About 9,000 doctors are applying to work abroad, and I've had so many friends who I've studied with and worked with who have left in the last week, last month, last year, and are leaving the next month to go to places like Australia, working in Brisbane, Sydney, Perth, Melbourne, Adelaide, and they're working for more money, having a better work-life balance, and being able to deliver the patient care that they want to deliver. And until we focus on retaining these talented British doctors, we're going to continue seeing the waiting list balloon. And as we've seen, in April, there were no strikes, and the waiting list rose by about 300,000. And that shows there's a real workforce crisis. And until we just pay doctors fairly for the skills they have and the sacrifices they make, then doctors will continue leaving.
I want the NHS to be out of the news. I don't want to strike anymore. I want to just get on with my work as a doctor. But when we have conditions that are like this and a government that just does not value our work, and because of that, it's really, it's leading to such awful patient harm. We have to speak up. We have to fight, and so that's why we're here today. That's why I still support the strikes, and we have to keep going until we have a credible offer from government, credible offer from any opposition, that any new government. Yeah, so we just have to keep going.